Everyone. Today we will discuss heavy metal poisoning. So basically, what is a heavy metal? Heavy metal includes both metal and metalloids, which have a relatively high densities, that is more than 5 gram per centimeter cube. And along with that, they should also have a second property, that is bioaccumulation. That is when in the food chain they should accumulate as they go from one step to the above. The group comprises of metals such as cadmium, lead, nickel, chromium, and metalloids such as arsenic. They can come either from natural forms through the ores inside the earth or can also come from industrial waste. The exposure can have varying systemic effects, which can range and affect the GI system to our reproductive system and hematopoietic and neurological system. The core mechanism through which they act is basically what they do is they increase the oxidative stress inside the cell and they overpower the antioxidative systems, which leads to denaturation of proteins and damage to the DNA. So either it will lead to cell injury leading to different pathological manifestations, or it can lead to defect in the DNA repair pathway, which will lead to carcinogenesis. So why are heavy metals important? If you see, this is the list of World Health Organization 10 chemicals of public concern which are associated with different human disease. And if you see, out of 10, 4, that is around 50% are heavy metals. And at the top is another heavy metal, that is arsenic, then cadmium, lead, and mercury. Each of these we will discuss in the incoming slides. So first, arsenic. So arsenic is also infamously known as the king of poison because of two, three things. One, it is very much prevalent in the core of the earth and it contaminates the soil water. Second, it is very much being used in the industries and is generated as part of industrial waste. And third, it has been the arsenic toxicity has been documented since very long in the olden times also. The effects of arsenic toxicity can vary and it basically depends on the dose at which someone is being exposed to the arsenic, the chemical structure of arsenic, whether it is a gas or inorganic arsenic or organic arsenic, and also for the duration, the amount of time for which someone was being exposed to arsenic. So based on all these three things, the toxicity and the clinical features will depend. Uh, Also, some people might have arsenic levels more than the cutoff, but still might not have any clinical symptoms or any uh, pathology going inside them, or it can vary from skin changes like hypopigmentation, hyperpigmentation, keratosis, and then can have systemic effects like hepatotoxicity, dysarrhythmia, and can even lead to death. Studies have also exposed that even if there is this subset of population that was being exposed to arsenic through some source and you later remove that population from that exposure, still then that population is a higher chance and it is at a higher risk of developing a cancer. So now if we see the world scenario, now this yellow uh, lines are representing the arsenic present inside the core of the earth, and from here it affects the water, the groundwater, and it is the sedimentary source of arsenic toxicity. And the red dots are representing the areas that are being affected through arsenic poisoning. And the places where you don't see any ore yet, the area has a red dot that signifies that the main source is not through sedimentary arsenic but industrial waste. Now in this graph, the size of the red dot is describing the how prevalent and how serious the arsenic poisoning is in that area. And if you see that in that Asian belt, the it is very high. Now this pie chart is basically representing the various source through which arsenic is coming into each continent. And if in Asia you see, the maximum it is through sedimentary arsenic, followed by mining, then coal, petroleum, and volcanic. Now the in Indian scenario, India, the officially reported last number is 23.98 lakhs. However, we will see that it is it is basically much more higher. So if you see, like I was saying, that it is arsenic is the king of poison because it has been reported from the very olden times also. So the first case report from India of arsenic poisoning is in 1976. It was from Chandigarh. Then later it was found out that even in areas of Bihar, there was patients of chronic arsenic poisoning, and the source was identified the tube well water. Now this was the last report from India on arsenic, and it basically uh, represented the area that had higher than the cutoff, that is more than 0.05 milligram per liter of arsenic in the groundwater that is capable of causing arsenic toxicity. And the top five states were Assam, Bihar, Chhattisgarh, UP, and West Bengal. So like I was saying, if you collect the data from individual studies and reports that were done, the total number somehow comes around 50 million. This was also a recent study in which they tested different parts of the country to figure out the arsenic poisoning. And if you see, almost all of the states have the issue with arsenic toxicity and arsenic poisoning in the groundwater. So because of the high prevalence, there is also this SOP about detection, prevention, and management of arsenicosis in India. You can check it. So when should you suspect someone that they must be having arsenic toxicity? The first, obviously, you should have the idea of the place they live. Matlab, if the place they live or the occupation they do predisposes them to arsenic. Then if that patient has skin symptoms such as desquamation, acneiform eruptions, hyperpigmentation or hypopigmentation or both, which is also called raindrop pigmentation, or any skin cancer like basal cell carcinoma, squamous cell carcinoma, these all, and palmoplantar keratosis, these all represent acute arsenic toxicity. While if someone has alopecia, stomatitis, vesicobular skin eruption, hyperhidrosis, maculopapular skin eruption, laminar peeling of hands, erythroderma, these all are suggestive of chronic arsenic poisoning. You can also just check hands of someone you are suspecting to have arsenic poisoning. If they have chronic arsenic poisoning, you can see findings like onchodystrophy, whitening of nails, that is leukonychia, transverse white lines that are Mees lines, or horizontal ridges that are Bewes lines. The sources in our country, most of it is from the contamination in water. Then it can come through different food items, and in the food item, it comes either through the water that is being used for the irrigation or through pesticides that are being used. Then steel industry, glass industry, fertilizers, pesticides, and again groundwater. Now the toxicokinetics of arsenic. So it enters through the body. It can either enter through inhalation, that is in the glass and smoke industries, or through the skin through direct contact with arsenic containing compounds, or through ingestion of food contaminated with arsenic. Then it gets inside the RBC, and through RBC it gets distributed to different organ systems. And once inside the cell, this arsenic, this 5 plus, if it is inorganic arsenic, which is the most prevalent, this 5 plus form is converted to 3 plus form, and then this 3 plus form captures this glutathione complex. And when it captures this, basically the cell is in a state of oxidative stress, which can lead to varying manifestations such as DNA damage, which can lead to cell death or cell injury, leading to organ dysfunction, or chromosomal aberrations leading to carcinogenesis. So this is again representing the metabolism of arsenic. From 5 plus form, it is converted to 3 plus form. Then it captures the methyl donor, that is SAM, and then it is converted to MMA and DMA. These are the urinary. This is the form in which arsenic is excreted through the body. So now we will see acute toxicity. So in acute toxicity, it can come through inhalational form, that is arsine gas. It is the most toxic form of arsenic toxicity. And you have to, matlab, the cutoff is if someone is inhaling more than 10 ppm of arsine gas, and it basically acts as a hemolytic agent. Symptoms of someone who have had acute arsine gas toxicity includes breath odor of garlic, headache, nausea, vomiting, diarrhea, dysarrhythmia, tachycardia, renal failure. And the symptoms can come as early as 1 hour or can be delayed by 12 hours, depending on the uh, amount that the person has been exposed. The typical triad that arsine gas has been reported to come with is abdominal pain, oliguria, and jaundice. This is the historic test that was used to diagnose arsine gas toxicity. Sometimes it might also present with subacute features, that is reversible sensory motor polyneuropathy and varying hematological abnormalities. Now, acute inorganic metal toxicity classically presents with bloody rice water diarrhea. Uh, Along with that, secondarily, it will lead to hypotension due to dehydration and volume loss, and further, it can lead to damage to organ systems like the lung, kidney, and brain. So, this was a case report of acute arsenic toxicity. And in post-mortem findings, if you see, this is the biopsy of the heart, and it basically you can see areas of necrosis. So again, the arsine gas or acute inorganic arsenic enters inside the cell, causes oxidative stress, leading to damage to the cell and cellular dysfunction. Now coming to chronic poisoning, which is more prevalent than acute poisoning. So chronic poisoning usually presents with dermatological manifestations. Uh, it can come with hyperpigmentation, hypopigmentation, or both, that is known as raindrop pigmentation, or palmoplantar keratosis, that is a advanced stage of chronic arsenic toxicity. It can also present with peripheral vascular disease, which is also known as blackfoot, along with nail changes, bruise, and measlines. Now, these are the dermatological findings. This is palmoplantar keratosis. This is hyper and hypopigmented lesions on the skin. Again, raindrop pigmentation. This is measlines, hypopigmented lesions, plantar keratosis. Again, same thing. Neurological manifestations of chronic arsenic toxicity. So it can present with symmetrical sensory motor polyneuropathy, and the patient will come with complaints of weakness, numbness, and paresthesias. And it can also be associated with encephalopathy, which comes with cognitive impairment, disorientation, loss of memory, hallucination. Then there was this HEAL study that was in Bangladesh, which proved that arsenic also increases all cause and separately cardiovascular mortality in patients with chronic inorganic arsenic toxicity. Uh, then it has arsenic has been proven to be associated with different cancers ranging from lung cancer, bladder cancer, skin and liver cancer. Uh, and these are the two pathways that have been found through which arsenic leads to carcinogenesis. One is gap dependent gene induction, and second is through hyposignaling pathway, which controls the growth of a cell. Now, this was a study which was done in patients, basically the patients with cancer and the patient who didn't have cancer, their arsenic levels was checked, and it was correlated that the patient who had cancer, they've also had increased level of arsenic inside their body. Other organ manifestations of arsenic in cardiovascular, it can lead to hypertension, QTC prolongation, dysarrhythmia, and it can also affect other organ system like endocrine, respiratory, and hematological. In hepatic manifestation, it has been associated with non-cirrhotic portal fibrosis. Now, diagnostic evaluation. First, you need the history. You need to know from where the person might be exposed to arsenic, which can through the occupation or through the area that he is coming from or through the water source he is consuming the water. Then you can take biological samples. The biological sample can range from urine, nail, hair, and you can also check the water supply. Now, there is no normal level of arsenic. Normal human being should have no amount of arsenic in their body and in their urine. So if you check someone's, basically you have to just check with whether arsenic is present or not inside their body. In case it is present, that proves that they are being exposed to arsenic at a level that is harmful to them. Then you can also check hair and nails, because the inorganic arsenic tends to uh, deposit in hair and nails. Other evaluation includes CBC to see anemia, abdominal radiograph to see any stones, ECG to see any QTC prolongation, dysrhythmia, and nerve conduction study for polyneuropathy. In peripheral smear, you can also see basophilic sibling. Now, the management is, first of all, you have to separate the patient from the source from which he is being exposed to, that is preventing ongoing exposure, and then chelation. Now, chelation is a varying school of thought, and some studies have proven that when giving chelation, basically arsenic again redistributes inside the body, which can rather lead to further deteriorating effects of arsenic on other organ system. And second, chelation is also associated with loss of other beneficial metals such as zinc and copper. Then you have to manage the arsenic associated skin cancers and pre-malignant skin lesions. Now, in case you have to give chelation to a patient for arsenic, the choice is either dimercaprol, that is BAL, or DMPS, or Succimer. Now, a little bit about arsenic in history. Basically, for a long time, it was said that Napoleon was poisoned with arsenic because later it was found that his hair samples and nail samples contained a large amount of arsenic. However, now this has been disproven because arsenic was very much prevalent in the paints and different household items that were used and in that time. So, if you would have checked anyone's hair or nail from that time, you would have found similar amount of arsenic levels. So again, it was not arsenic poisoning. Then arsenic was also being used as a medicine in olden times for different skin conditions and cancers. So steps ahead. Basically, like I said, the most common source of arsenic contamination in areas like UP and Bihar is the sedimentary source that is contaminating the tube well water. So that is why the government is proposing Jal Jeevan Mission that aims at providing a government supplied water source through a tap at home, which has been disinfected and it has been the cleared off the heavy metals. So now coming to lead. So the first time I heard about lead toxicity was around this infamous case that how Maggie contains the harmful amount of lead in it. So initially the company denied it and said that the water that was used to cook Maggie contained it, and it went off and on and off and on, and later finally they accepted that maybe there was this one plant that had higher amount of lead or something like that. You can check it in the news. So lead is more associated with children because of the neurodevelopmental pathology it can lead to and how it can hinder the neurodevelopmental process. Lead poisoning. So basically, acute lead poisoning can present with very severe symptoms of toxicity, or can sometimes also present with non-specific signs and symptoms. Again, depending on the duration and the exposure of lead, for which was it organic or inorganic lead, or for how long was it exposed. In addition, chronic exposure can lead to varying levels of lead in the blood, and which then, according to the level inside the blood, will have varying clinical presentations. The cutoff for lead, like for arsenic, there was no cutoff. Any amount of arsenic found in someone's urine is suggestive of arsenic toxicity. However, again, lead is a very prevalent heavy metal around us. So it is bound, you are bound to have some amount of lead in your blood. So there is this specified cutoff for lead, which is BLL, blood lead levels, that is more than 3.5 microgram per deciliter. Despite that, usually this is the cutoff value. The toxicity usually starts when the mean blood lead levels are more than 10 microgram per deciliter. So world scenario again. Basically, this map is showing with color grading, with red being the highest and yellow being the lowest, the countries with maximum lead toxicity through various sources. And as you can see again, we top here. Then there was this one UNESCO report which suggested that 1 out of 3 children in the world suffered from lead toxicity. Now coming to Indian scenarios, there was this another local study that was done in 2013 which showed that how in Calcutta, 1 out of 5 children suffer, 1 out of 5 child suffers from lead poisoning. Then there have been many studies that are done to see the lead toxicity in India. Then there was this one interesting UNICEF report, which was along with this organization Pure Earth, which exposed that how it is the problem of lead toxicity in India, especially in the growing population in children, is being undermined. Once this report was released, even Indian government released the SOPs and the response to it, in which they again assessed the loopholes which might have been missed and the places that might have been missed and what is their action to keep a control on it. This was done by CSIR and Niti Aayog. So this map represents the average blood lead level prevalence in various states of India, and Bihar tops it, which is 10.42. The cutoff was 3.45. Toxicity comes at 10, which is then followed by UP, MP, Jharkhand, the same states which had high arsenic toxicity. Now, the sources of exposure for lead can be through workplace. There are certain industries that are expose you more to lead than through paint, through gasoline, bullets, and through drinking water or illegally distilled alcohol and at last herbal supplements. So, like we were talking about illegally distilled alcohol, there is this one liquor, moonshine, that has been infamous for containing high amounts of lead in it. Then there have been many case reports in which they have found that a patient came with signs and symptoms which were either specific or non-specific, but later they find out that the patient had lead toxicity and which was on retrospectively found to be associated with use of some herbal medicine. Then lead has been also been found in adulterated uh, kitchen masalas and kitchen spices. Then again, this like I was talking, lead glazed cookware is also another source, and this is not a very old thing. Like it was just in 2024 when certain states outside became the first, like countries and different states became the first to ban lead content cookware. Now this figure is only showing that how prevalent is lead. It is in your bedroom, it is in the paints you use, it is in the utensils and the other different household products you use, it is in the detergents and dishwashers you use. Then it can be in your food, it can be in your spices, it is in different coolants and different other chemical products used for your machineries and in the repair products of your car, and then in your again through water source. So basically you are surrounded by lead. Again, it is a chart and a table showing possible exposure of lead. Occupationally, it comes from battery work, then mining, glass manufacturing, automobile repair, painting, pottery, plumbing, and non-occupational is through use of traditional medicines, then through vehicle exhaust, lead-containing sindoors and cosmetics, household storage batteries, and other things. Now again, it was a recent article at that time when I first presented this seminar. Just few days back, international agency flagged that the spices which India is exporting contains high amount of lead and other toxic chemicals. Now, this is one story of hope. This map shows the countries that were using lead in their gasoline, lead in their petroleum products, in petrol and diesel. And then this map was 10 years ahead of it, and this map is around in 1980s or 1990s. And as you can see, that we successfully limited and prohibited the use of lead contaminated petrol in whole of the world. Now coming to recommended lead levels by different authorities, again there is no safe level. The threshold for action is 5 microgram per liter for BLL, blood lead level. Then in air it is 0.5 microgram per meter cube. In drinking water it is 10 microgram per liter, and soil 400 ppm. Now coming to toxokinetics, basically first you get exposed to it, then it enters your body either through inhalational or ingestional route, then it enters into your blood. Now this blood level suggests recent exposure. However, when it comes inside the blood, it gets exchanged into the skeletal system and gets stored inside the cortical bone. And now this cortical bone will is a marker of the cumulative lead that has been exposed over time. And usually, in case if it is checked in the tibia. So basically, if someone is exposed to lead, the maximum level they will reach is in between 20 to 36 days. Then that is followed by soft tissues for 40 days, and at last in the mineralizing tissue where lead stays for more than 25 years. Through here, it gets bioexchanged in little or not, very little amount, and gets excreted through kidney. Now, clinical exposure we will again see as acute, subacute, and chronic. So, acute. Now, acute lead toxicity is also known as plumbism. Now, this is a story. So, basically, what happened during the Roman Empire, they were refining silver ores. So, when they used to refine the silver ore, there used to be this liquid part left behind it. and they used to call it plum, which meant in the Roman languages liquid silver. Now, this plum material that was left was very malleable and very easy to like you can use to shape. You can make easily different shapes from it, and it was very handy to use. So then they started to use this plum for their water irrigation and water supply system, and thus the guy or the person who was dealing with this was called plumber. And now that word from the Roman Empire has stayed still. Now later it was discovered that the plum, the liquid silver, what the Romans were referring to, was actually lead. And then there was this school of thought that maybe this through this water system, the water supply was getting contaminated with lead, and the population and the leaders suffered from lead toxicity, which led to neuropsychiatric manifestations, and that might have eventually led to all the wrong decisions, leading to the downfall of Roman Empire. However, it is just a school of thought and has not been yet proven. So now acute exposure, like I said, you in acute exposure you can check the blood levels, because in the blood it will stay for 28 to 36 days. If even if it is less than 5 microgram per liter, it will have a effect, which is decreased IQ, ADHD, anemia, impaired renal function. In between 5 to 10, if it is in a developing child, they will have delayed puberty. In an adult, it will lead to hypertension, increased CVS mortality, and in the pregnant female will lead to abortion and preterm birth. In between 20 to 40, it will start affecting the nerves, leading to neuropathy, interfering with vitamin D metabolism, and again predisposing to anemia by interfering with hemoglobin synthesis. In between 40 to 90, it will have spasm in your intestine, leading to abdominal colic, neurobehavioral disorders, and frank anemia. More than 90, it leads to encephalopathy, and if more than 130, it leads to death. Now, basically, how lead leads to this neuropsychiatric manifestation, decreased IQ, ADHD, is by interfering at the synaptic terminal. It gets attached to the receptor present on the presynaptic area and interferes with transmission of impulses and transmission of various neurotransmitter, which then leads to alteration in our cognitive function, leading to all those effects. So basically, this was one study done in which children were assigned based on their IQ scores, and then their blood lead levels was checked, and the blood lead levels got superimposed to the IQ. The child with the maximum amount of blood lead level had the lowest IQ. Now coming to chronic poisoning usually comes with neurological or psychiatric manifestations, anemia, hypertension, and basically it leads to renal dysfunction, leading to uh, decreased excretion of uric acid. Along with it, lead also interferes with uric acid metabolism, and that leads to gout, which is known as Saturnin gout. Now again, this was a study done in USA in which they checked that how when different SOPs were made and different interventions were done to decrease the amount of lead toxicity in children, it also led to decrease in crime rate, and how maybe it was maybe the lead that was affecting the synaptic transmission and leading to aggressive behavior. Now, how will you evaluate lead poisoning? Again, you need to have a proper history to figure out that how and where this patient might be getting exposed to lead. Then on examination, you can find these gum lines and these teeth lines. In blood test, you can have basophilic stippling, anemia, metaphyseal deposition of lead in X-rays, and then at last you can either check blood lead levels, or you can also check increased erythrocyte protoporphyrin. Now, unlike arsenic, in which there is not a very proper guideline that you have to use chelation or not, and there are many reports and school of thoughts that suggest that how chelation might lead to further damage. In lead, you have to do chelation based on the blood lead levels. As long as they are 9 microgram per deciliter, you don't need to do anything. You just need to educate that person, and you need to prevent further exposure and repeat levels after 6 months. In between 10 to 19, you have to assess for any lead associated health effect that patient might have. That includes anemia, hematological manifestation, any decrease in school performance, and based on that, you have to assess further. If in case you find that the patient has symptoms related to lead related toxicity, which are usually seen when lead levels are more than 50 microgram per liter, the patient needs chelation as it may benefit them. Then coming to chelation therapy, the first choice of chelating agent for lead is DMSA. Then it is EDTA, followed by calcium and vitamin C. Also, you have to supplement iron, however, not during the chelation therapy. Once you have, once you are over with chelation, you need to monitor blood lead levels at 6 monthly intervals. Now, again, what I was telling about plumbism, that how the word plumber has stayed and how the Romans were also maybe exposed to high amount of lead. Now, coming to mercury poisoning. So basically, mercury exists in three states in our environment. One is elemental, then organic and inorganic form. And the toxic manifestation of mercury depends what mercury form are you being exposed to. Now, first coming to elemental mercury toxicity. The source of exposure for elemental mercury is at the site of manufacturing, like CNG bulbs or the thermometers or artisanal gold mining, in which they try to find small pieces of gold through like this flowing river, and they might also contain, apart from gold, lead. Then dentistry, because the lead they use, sorry, not lead. Mercury. The mercury they use for amalgam can also lead to elemental mercury toxicity. However, it was a hypothetical thing. The World Dentistry Association has denied and debunked this myth. Then clinical manifestations, if you are this acute, in case you are exposed to organic mercury acutely, like if someone of you breaks a thermometer and you touch it, है ना? So it leads to pneumonitis, or if you inhale it. So basically, this is a patient who was exposed to elemental mercury through inhalational route, and these are the serial X-rays, and you can see how this is a 7-day X-ray, and that patient had severe ARDS. Then it leads to conjunctivitis, dermatitis, stomatitis, and vomiting and diarrhea. Now coming to chronic elemental mercury poisoning. Initially, it leads to mild neuropsychiatric symptoms such as insomnia and irritability, intentional tremors. Now, this intentional tremors thing also is a story. So basically, in olden times, people used to wear hats and they were in fashion. So there was this process called carroting, in which they used to make a low quality fiber look like a high quality fiber. So someone in Europe discovered that if you use camel urine in this carroting process, that gives the hat a better. Matlab it looks far more expensive, and the fiber looks far better good. But in America, they don't have camels. So what they started to do, they started to use human urine. Now in one factory, they figured out that there was this one subset of hats that was far superior and far better than others. Then they realized that these hats were being the sample of urine, same sample of urine was used for all these hats, and then they went back and figured the urine was from a woman who had syphilis, and she was on medications, and at that time mercury was also used to treat syphilis. So then what these smart people do is that they actually started using elemental uh, mercury for this process, and every person who was involved in this process had chronic elemental mercury poisoning leading to tremors, and they were famously known as Denbury shakes, and it was also called Mad Hatter's disease because they also had neuropsychiatric manifestations. Now this all was figured out by this Dr. Alice Hamilton in 1869. She lived from 1869 to 1970, and she is also known as the mother of occupational medicine. Then it also leads to nephropathy and membranous nephropathy, acrodynia, and tubular dysfunction. Now, diagnosis again, you need to figure out where and how this patient might be getting exposed to elemental mercury. You can check the blood levels, the urine levels, and treatment basically, if all heavy metal toxicity, the first treatment is removal from the exposure, supportive care, and chelation therapy if you find that 24 hours urinary mercury is more than 100 microgram per liter. The choice of chelator is succimer, that is DMSA, and BAL. Uh, BAL is given as a deep IM injection. Also, you can use DMPS. Now coming to inorganic mercury. So the sources of exposure to inorganic mercury is through mercury chloride or calomel, which was a drug that was earlier used for treatment of different disease. It was also used in the system of treatment in which they used to bloodlet. Used to think that if you remove a large quantity of blood from a patient, the disease will get cured. And in that also they used to give the patient mercury shots. Uh, these all images are only depicting that. It was used for a yellow fever historically. Then in chloralkali industries and plating industries and Ayurvedic medications, there are different testimonials and reports of how people were exposed to mercury through Ayurvedic medications. Now again, clinical manifestations, acute and chronic. Acutely it presents its abdominal pain and again bloody diarrhea. And chronically it has neuropsychiatric manifestation like irritability, gingivitis, stomatitis, nephrotic syndrome, acrodynia, tubular dysfunction, mostly grossly similar to elemental. Now management again, history, 24-hour urine and blood mercury levels. Treatment is removal from exposure. You have to aggressively resuscitate fluid, considering it leads to gastroenteritis and chelation. Again, if more than 100 microgram per 24-hour urinary level, you can chelate. So now coming to organic mercury. So the source of organic mercury is usually through mercury contaminated fish, which is usually through all the toxic waste that we dump into the ocean, and it is very teratogenic. So basically, there is also a list of fishes that are usually not allowed to be eaten in pregnancy, and this is the list of best choices of fish a pregnant woman can eat. Then this is basically a second probable source of exposure to organic mercury is when it is being used in laboratory for different experiments and through skin creams. There have been multiple case reports where mercury has been found in anti-aging and skin lightening creams. And then initially it was said that mercury was also associated with autism, and it was due to its part in the thiomersal and merthiolate compound in vaccines. However, it has been debunked and it has been proven that it is not associated with anything, autism or anything else. Now, clinical manifestations for this organic mercury for acute toxicity, we will see this case of Dr. Karen. Basically, she was working in a lab with elemental mercury and has accidental slippage of few drops at her skin. And initially, they did not think of it as much, but later she started having symptoms such as difficulty in memory, difficulty in uh, walking, gait disturbances, and visual spatial orientation. So basically, again, like I said, there was few drops that were exposed to her skin, and this is only her blood mercury levels days after the exposure. So for 3 months she was fine, and then later she started to have increase in the levels, and these levels drop after chelation. However, despite everything, not much could be done, and she debilitated and died due to mercury toxicity. This is a cerebellum cut section. This is a normal, and this is of a person who has been exposed to organic mercury. And you can see how much cerebellar atrophy a person goes through if they are exposed to elemental mercury. Organic mercury toxicity is also a famous story. So there was this Minamata city, and this Minamata city had one large water body, and basically which served as the water source for most of the households and for the animals around in the city. And there was this one industry that was dropping its waste inside this water body, and people got contaminated to mercury through this. So before anyone witnessed and anyone figured out the large number of people who were having different manifestation of mercury toxicity, people were reporting weird behavior in local animals. Like they would report that the cats in the area would keep circling around to a point and die, or there were large number of birds who were failing through the sky. But it was only far later that some people started to join the dots and figured that how a large number of people in that city were having bony abnormalities, were intellectually disabled, had ataxia and cerebellar dysfunction. This chart is from the actual paper that was published at that time about the symptoms seen in the people who were exposed to it. So the three most common symptoms that were seen was constriction of the visual field, sensory disturbance, and ataxia. They followed by dysarthria, disturbance of gait, chorea, athetosis. So basically, what happens is mercury inside the body goes, forms a compound methyl mercury. It gets exchanged in the cell with cysteine, and now the methionine cycle gets disrupted, which hinders the methionine exchange cycle, hindering cell function. So again, this shows a normal brain section in a person who has been exposed to organic mercury and their brain section and the amount of atrophy it goes. Basically, after this, there was this Minamata Convention, which was an international agreement to protect people from exposure to mercury. And there is also a famous movie of Johnny Depp on this. Similar thing happened in Kodaikanal, Tamil Nadu, where Hindustan Unilever Limited was dumping its waste, which contained mercury. However, people were smarter this time and they figured it out very early, and there were large amount of protests, and even the NGOs got involved, and there were petitions signed for the company to figure out and stop dumping its waste. And this was the first example of reverse recycling. The Hindustan Unilever Limited was forced to take all the mercury waste that it brought from the Western countries back to them rather than disposing them off in India. Again, management includes history to figure out the source and of exposure. Then you can check blood mercury levels, and treatment is removal from exposure. Now, coming to cadmium toxicity, cadmium again can cause both acute and chronic toxicity based on the levels you are exposed to. However, acute toxicity is less common. And depending on the source, it can either affect your gut or lung. The source of exposure to cadmium is mining and non-ferrous smelters, electroplating and battery industries, phosphate fertilizers, and cigarettes. Now, epidemiology, basically, if you see, this is again an Indian study which shows that there is, even of cadmium, there is a prevalence of high levels in the metro cities of India. So, in total, if you see, the cutoff value was taken as 1.5 microgram per liter. 1.9% of the adults had higher levels than it, of which 2.5% were males and 1.2 were females. And then toxokinetics, basically, after absorption through the various sources we talked about, it get distributed through metallothionein and gets eliminated via kidneys. Now, pathophysiology is chronic exposure causes toxicity to two organs, kidney and bones, and is also associated with lung cancer and emphysema. In kidney, it can lead to isolated tubular defects, and in bone, it leads to osteodystrophy, which has also been famously known as Itai disease, which translates to ouch ouch disease. So these are the figures of that time of the people who had chronic cadmium toxicity and had bone disfigurement and osteodystrophy, and it can lead to lung toxicity and cancer. Evaluation is again the same. You have to take history and figure out the source of exposure. You can diagnose it through urine routine. The urine beta 2 macroglobulin has been a biomarker that can be used, or you can check blood cadmium levels. These are the cutoff for blood cadmium levels, beta 2 macroglobulin per gram of creatinine, and other. Again, there is no treatment for cadmium associated CKD. Cadmium associated osteomalacia, that is ouch disease, has been treated with large dose of vitamin D. Now, coming to acute toxicity, though it is rare, the exposure can be through inhalational route or oral route. Diagnosis again is through history, and treatment is not much. Uh, Thank you. This was the Earth Day theme when I first presented the seminar. I don't know what is now. And also, I got too excited and checked my hospital's heavy metal in the water supply, and my hospital was safe, and they were far below the levels that are suggested. Thank you.